Henoch-Schönlein purpura. It is also known as the anaphylactoid purpura. It's the very common small vessel vasculitis syndrome, mainly occur in the children. Mainly it occurs in the preschool children who are less than 3 years of age. In this disease, there is the inflammation of the small vessels of mainly skin, joints, and GI tract and kidney. Small vessels present in these organs mainly get inflamed. It is mainly due to the IgA mediated autoimmunity, and it usually followed by the any viral infection. Mainly there is respiratory infection or any infection involving streptococcus, staphylococcus viruses, and then these viral infection followed by the small vessel vasculitis, mainly in these organs. And in this case there is deposition of the IgA. Mainly IgA deposits are present, but IgM and C3 deposits are also present in the vessels. There is inflammation of the vessels. Here it shows is a small vessel, and this is the edema of the vessels due to the inflammation, and there is infiltration of the leukocytes and extravasation of the perivascular exudates and perivascular RBCs. Extravasation occurs, and these extravasated RBCs form the purpuric macules. These are the raised reddish purple spots or bruised areas which are mainly present on the legs, feet, buttocks, but may involve the entire body. And these purpuric macules may progress to the hemorrhages, which are mainly present on the elbows and knees. Due to the exacerbation of the perivascular fluid, there is also subcutaneous or localized edema. That mainly occurs in the region of the forehead, dorsum of the hands and feet, periorbital areas, lips and scrotum. So in these areas there is a localized subcutaneous edema. The presentation may look like these are the schematic diagram which is showing the subcutaneous hemorrhages or purpuric macules and ankle edema. Here is another picture of purpuric macules mainly present in the lower legs, and ankle edema is also present. Here is the mnemonic for its clinical manifestations, that is NAPA, and for nephritis, that is glomerulonephritis. Due to the glomerulonephritis, patient may present with the hematuria, that is maybe the gross or microscopic, or continue renal involvement may lead to the development of the nephrotic syndrome, hypertension and renal failure. A for arthritis or arthralgia, there is a pain and swelling of the joints, and pain, tenderness and pain on the movement is present. P for purpuric rash, that is palpable, that is present on mainly on the lower limbs, lower back, buttocks, but may involve progressively it may involve the entire body. Ecchymosis, petechia and hematomas may also present, and these purpuric rash may progress to the gross hemorrhages. Then A for abdominal pain. Some children may develop colic abdominal pain, vomiting and occasionally melena due to the involvement of the blood vessels of the intestinal tract that simulate the acute abdominal emergency, and it may be the initial presentation, but on investigation it comes out that it is not any acute abdominal emergency case, but it is the Henoch-Schönlein purpura, and this need to be the to be differentiated from the intussusception, that is mainly done through the ultrasonography. And rarely the central nervous system can also be involved, and due to its involvement and bleeding in the vessels of the central nervous system, convulsion, paresis, coma can also occur, that may be the fatal. Now lab investigation diagnosis is mainly clinical, but lab investigations are done to rule out the other cases. GI blood loss may present with anemia, leukocytosis, thrombocytosis may be present, ESR may be normal or high, ASO titer are raised. CBC and blood coagulation studies are normal, and blood coagulation studies is done to check that if there is any blood coagulation abnormality due to which these hemorrhages or petechias are being developed. Serum IgA is raised, anti-cardiolipin and anti-phospholipid antibodies may be raised. Definitive diagnosis is done by the biopsy, renal biopsy is done, and skin biopsy. Renal biopsy shows deposits of the IgA mainly, but IgM, C3 and fibrin deposits are also present, and it shows the segmental glomerulonephritis with crescents formation, and meningeal proliferation is also present on the biopsy. Skin biopsy shows vasculitis, which confirms the diagnosis. Treatment is mainly sportive. Bed rest is suggested. Adequate hydration, bland diet are suggested, and for the pain control, paracetamol is given. Leg raise technique. Leg raise is advised to lower the ankle edema. Avoidance of the competitive activities and avoidance of the any offending drugs and allergens is suggested. For the streptococcal infection, if there is still streptococcal infection is present, then penicillin is suggested. Aspirin is given for the joint pain. Steroids are given for the symptomatic relief of severe GIT or joint manifestations, and it does not affect the skin and kidney manifestations, but it is only for the GIT or joint manifestation. Chronic or recurrent Henoch-Schönlein purpura is treated with the pulse dose of the IV methyl prednisolone, which is given 1 gram per day daily for 3 days, and then 1 to 2 times weekly, then tapered gradually. If there is progressive renal involvement and complications of the renal system are presenting, then high dose immunoglobulin therapy is given, that is azathioprine, cyclophosphamide, cyclosporine and mycophenolate mofetil.